Well, folks, today I am super excited. I should say, we'll be talking with Dr. Serena Liebengood. She's the founder of the Howard C. Liebengood Foundation. And you probably have not heard a lot about it, but I think you will hear today how impactful the foundation is in the policing community. We'll talk a little bit about how that foundation was born from profound personal loss and its mission being focused on something much larger, protecting the mental health and well-being of the men and women who serve our communities in wearing the badge across America. Serena, thank you so much for being here. The name of the foundation is after your late husband, who I think you refer to as Howie. Some people may know about his involvement in January 6th and the aftermath, but tell us, if you can, before we talk about the foundation, tell us a little or a lot about Howie. Who was he?
Sure. Thank you. And thanks for having me here. My husband, Howie, we were almost married 10 years. He was 51 years old, and a U.S. Capitol Police officer. And he grew up on the Hill. His father was in law enforcement. It was in his DNA. He always put service before himself. And I think that ultimately his service led to him dying by suicide.
And his father, I think, was played a very important role at the Capitol.
Yes.
Is that right? And then we can
Yes.
maybe circle back. What role did his father play?
His father served as the Senate Sergeant at Arms during the Reagan administration.
And that is the kind of the function that is part of the oversight for policing and protecting the Capitol.
Yes, yes. And so it was very important. And each time he would arrive on the campus he was on, he grew up there. That was part of his history.
And so he would follow his father's footsteps and join the Capitol Police. And I've spent a fair bit of time with the Capitol Police. It's a fantastic police force. It's over 2,000 law enforcement officers, and their focus is to protect the Capitol and all the people inside. And so, unfortunately, Howie was part of, or he was a true casualty of the January 6th riots, if that's correct.
Yeah, he protected the Capitol on January 6th. But one important thing I want to highlight that, and it's not just Howie that I've come to understand about, law enforcement. It's the cumulative impact of showing up to work day after day, dealing with the traumas and the exposures. And so, like Howie, there's so many officers over the years that succumb to suicide because of the work-related stressors.
No, for sure. We've talked a lot about in this podcast about mental health and the importance of creating awareness, because in effect, it's somewhat analogous to kind of the CTE in football. In other words, this kind of repetitive injury over and over and over, and this is repetitive in a mental context in terms of these everyday stress of the job generically, and then these major events that major kind of incidents that police officers have to deal with. I think it's roughly estimated in an average police officer's career, they'll have somewhere between 40 to 80 of these major life events that would be equivalent to us losing a loved one or us being in a major car wreck. They go through we go through 3 or 4 of those, and they go through 40 to 80 of those in their career. And to your point, it builds up over time. I assume that January 6th, though, was kind of an unfortunate catalyst for Howie deciding to take his own life.
The events were certainly stressful, and I want to, highlight like some of what made this very stressful for Howie. And again, this is what a lot of officers experience: long hours. He worked several consecutive shifts without, getting proper rest. It's very stressful. There was a lot of uncertainty. And so, and we see that like so commonly in the law enforcement field these days, especially with the protest. And I mean, the officers are put out there to protect and serve, and there's just so much uncertainty.
No, for sure. What people don't realize, I don't, and again, and this podcast is intended to try to educate folks that aren't part of the policing community, is that most agencies in the United States are understaffed, kind of at the 80% level, and as such, it forces all those officers to work overtime. And to your point, when you have these events. Protests, riots, as such, it's only magnifies an already challenging situation. I think most officers work 6 days a week, normally 12 hours a day, which is in itself a lot, and with that kind of mental stress, even more. And then to your point, you add on these kinds of more significant events. Before we transition to the foundation and how you've taken what is horrific and tried to find and have created something good from that. Anything else about Howie that folks listening should know as we talk about his foundation?
Certainly. He was just a very dynamic, loving, giving person, fantastic husband, uncle, and he basically dedicated his life to, his mission to protect and serve.
Which is fantastic. I mean, that's consistent with every, with the 99.9% of the police officers I meet. They're cut from a different cloth. In terms of their willingness to put their own life at risk for the community. It's this, to your point, it's this DNA. Their call to serve is unique. It's it's very much like yourself. I mean, you being a doctor, right? In terms of your call to serve, you're just wired that way. You must have made a fantastic couple, and I'm super sorry for your loss.
Thank you. Thank you.
So, this notion of taking something as traumatic as losing your husband to suicide. You've found a way to turn that into a positive. What was the when did you start thinking about how to create this foundation, or the impetus for moving in that direction?
Absolutely. Um, During the first year following his death, I was obviously consumed with grief. But during that time, I started to attend a lot of law enforcement conferences. I connected with Howie's agency. I connected with other law enforcement officers, and I just began to learn a lot more and gain greater perspective about law enforcement suicide. I thought it was unique. It was not unique, unfortunately, and it was so common. And it I was shocked to learn, and each time I would speak to someone, they would tell me about a former partner or friend that died by suicide, and I realized how common this was, and I realized that more needs to be done. I'm a physician. I have a background in public health. I'm a widow, and all of this, I turn a lot of my pain, and I was like, I have to do something about this. Um, and my approach was, I looked at all of these different areas, like what could have changed this outcome? How could I have changed this trajectory? And that was my approach to finding to creating the foundation. I looked at all of these different areas that, in my mind, being were not recognized as they should, such as the organizational change piece, the agency, as well as the opposite end of the spectrum, um, um, uh, allowing access to culturally competent mental and medical health care services.
This it's an incredibly complicated and challenging a complicated and challenging problem that law enforcement and it's equally true on the fire side as well, that emergency responders face. It's this how do you first, how do you acknowledge it, to your point, and just bring it out into the open? I tell my friends when they ask about what I do and about policing, I always, to your point, shock them with a couple of statistics. Is that more officers die by suicide every year than those who are killed in the line of duty. I think it was over 156 or more officers committed suicide last year, more than those that were killed in duty, which always seems, to your point, shock people. And that I then remind them that the average life expectancy of a police officer who has gone through at least 20 years of service, their life expectancy is, I think, 65 years old. They are 10 years, if not 15 years less than the average population. And so it's a horrific kind of mortality rate, so to speak. So just bringing awareness seems to be the first challenge. As you became more aware, what surprised you about how about this notion of officer wellness and suicide prevention? What surprised you, I guess, in the good and the bad context?
Yeah, I realized that there is an incredible body of research out there, tons of resources, funding available. And yet, despite all of these resources, there was a huge discrepancy in terms of the suicide rate or the number of agencies that have comprehensive health services. And so that was very shocking to me. I and it also contributed to my desire to figure out how can we bring a lot of these resources and best practices and research, make it digestible and accessible to the agencies so that they can utilize this information.
Well, and that makes sense. As I talk about when I talk to sheriffs or police chiefs that come on this podcast, they talk about the importance of mental health, first acknowledging that it is an issue and making it and creating a culture that allows people to raise their hand and acknowledge that they are, feeling the effects as they should, and they as being a normal human that they would. So they then talk about trying to bring in resources, but to your point, those are typically very localized. They're kind of I don't know the right word. Not particularly sophisticated. It's kind of, they try to kind of figure it out on their own. And maybe this is part of what you think the foundation can do to help is bring best practices to these 18,000 agencies.
100%. And one of the programs will focus on change management and organizational development, and it's bringing in experts in change management. It's bringing in or incorporating research, best practices. It's creating a system where people can learn, be mentored, engage with one another so that they can create these changes in their agencies, whether or not you have a staff of 15 or 1,500, whether or not you have $0 in your budget versus you're pretty well funded. And so I want to create a resource, and I don't have any ulterior motives. I'm not making money. I'm not, there's no benefit to me other than making the environment, making the culture better for law enforcement officers. And I admit, it's not sexy. It's not easy. It isn't as simple as an app or something you can download. It takes time. It's a process, and it takes a lot of engagement. But I realize it's so important. And I think if we're going to truly make changes, if we're going to truly try to deal with this elevated suicide risk, these are some of the foundational changes that we need to make.
No, for sure. And you're being thoughtful by the use of the word elevated. I mean, it really is a epidemic in that context, right? That you'd have almost 200 officers take their own lives, both while they're on duty and then and after they've retired. It's something that has to be addressed. It's interesting the way that law enforcement is structured in the United States. One of the strong, and it's very unique across the world in that there's 18,000 agencies. And so it's unique in that each community gets to dictate its own policies, its own, they get to control the policing, right? It's not a national construct. And that's, that comes, kind of out of the American Revolution. It's kind of the Minuteman effect, so to speak, in terms of protecting your own. That's the powerful construct that policing can be very local and very personalized. The negative is that you've got 18,000 agencies that are under no overarching structure, and so you have to find ways to communicate to them and to get those resources to them. I assume that's so. Let's turn to the foundation itself. For those that that are just kind of trying to Google it as they listen to this, tell us just in simple terms what the foundation is and what its purpose is.
So our goal is to improve the health and wellness of law enforcement officers through interdisciplinary collaboration, education, and research. And simply put, with the first responder, the law enforcement officer in mind, we are focusing on the system, the structures that directly impact the first responders to create change. And we have several programs in development, including the symposium, the change management program that I referenced earlier. Those are two of our major programs that we are focusing on. And then there are other components that will focus on the healthcare piece as well.
To be accurate, you talk about emergency responders, and I've been talking about police officers. Is the foundation extended to address folks, all types of emergency responders, folks who are as all walks of life, or is it more focused on policing?
We are focusing on primarily law enforcement officers, but those in fire, dispatch, all first responders are welcome to partake.
Yeah, I think that's the again, it's part of what the again, my friends, and that's again why I started the podcast. It's my friends, business executives, who don't really understand. There's over 2 million emergency responders out there. If you kind of add in all the firefighters and police officers and 911 dispatchers, and they all suffer through these mental impacts, these kind of repetitive injuries to their soul, so to speak, from what they have to deal with and experience, then that the foundation can help and start to lay the groundwork for that is fantastic. So the first element that you described is change management, which is basically providing tools and education and access to resources that help police chiefs and sheriffs figure out how to bring a mental health program into their own organization. Is that a fair way to characterize it?
Not necessarily a mental health program, but dealing with some of the operations that can impact the health and wellness of the law enforcement officers. Um, and ultimately, this program could be used to develop or refine a mental health program, but we're not specifically focused on a mental health program, but the outcome will hopefully improve the health and the wellness of the officers.
Okay. Yeah. It's back to your point about it's more systematic and more structural in the sense of helping them understand how to bring change, how to bring new techniques, new thinking, new kind of helping them change culture independent of the topic,
Correct.
which is fantastic. I mean, that's, in itself is impactful well beyond mental health. If you think of all the different, things like use of force and managing their own, officers in terms of managing their own biases as they come in as a police officer. There's lots of things that chiefs across the country are trying to change for the good in policing. And so great that is your kind of first plank. Now, this I've gone to the website, and I hope folks will go. In fact, why don't you tell the folks what the website is, and then we'll talk about the people that I've seen on there.
Sure, hclf.org.
So it's very simple, folks. hclf.org. Some really impactful folks in terms of that are a part of the organization. I don't know if you want to highlight beyond yourself any of the folks that are really bringing leading edge thinking into policing.
Absolutely. So we have Dr. John Violanti, and I always joke with him that he's the OG. He has done a lot of groundbreaking research in terms of law enforcement, health and wellness, not just the mental impact of the job, but also the physical risk, the health risk. He's one of our board members, and he's at University at Buffalo in New York. We have Dr. Kathleen Sutcliffe. I'm a Hopkins faculty member, and she's a Hopkins emeritus faculty member at the Carey Business School. Her goal and her focus is looking at change management, resilience. And so it's about bringing in experts from different sectors so that we can figure out how to best solve this problem. And then also two people I want to highlight. Jim Pasco of the FOP, the National Fraternal Order of Police, and we have Terry Cunningham from ICP, Labor and Management, working together to figure out how we can come up with a solution. And so those are the kind of people that we have. And I mean, visit the website, but we have individuals who they have the experience, they have the expertise, they understand the issues at hand, they understand how much of a crisis this is and how collaboration across sectors and disciplines, it's important to really figure out, how to solve this problem.
I was super impressed when I visited the website and you and I had a chance to chat beforehand, because you brought um, you brought the most impactful um, or entities in policing today that influence how policing is managed across these 18,000 agencies. The FOP is the largest police union in the United States, almost I think 500,000 members, of which is dedicated to taking care of those brave officers and giving them all the things they need in terms of policy equipment, and particularly things that that the foundation is focused on. So that's fantastic. And then the IACP is the largest policing organization in the world that brings all different policing entity organizations and associations together under kind of one roof to really dictate again, policy, education. Their annual conference is fantastic as a meeting ground for all these folks, and to have those folks in combination in the same room with these educators, these experts in these areas, it must be really inspiring.
Yeah, it's exciting. And to me, it's just, I view it as an opportunity to really create change, to drive change.
And it will happen with those folks involved. You mentioned the symposium. I'm super excited about it. I'll
Thank
Pepperball,
you.
who sponsors this podcast, as I said up front. Pepperball will be a sponsor. We're super excited about being there. Can you tell the folks
Thank
about the
you.
symposium and what's going to happen there?
Absolutely. So, for a day and a half, we are bringing folks to Washington, and we are doing this symposium in conjunction with Johns Hopkins Carey Business School. And the goal is to figure out how we can help law enforcement officers and other first responders weather this changing, difficult environment. We address policy, some of the legislative changes. We address labor versus management, how we can work together. We also have a section that discusses leadership lessons learned. And we have, Vinita Gupta, we have, other folks that have dealt with mass casualty events, to give us insight to really figure out, based on these lessons, their experiences, how we can take this to the next level. And we hope that this symposium will be interactive, engaging, and also just very content rich. And on day 2 of the symposium, we will have a workshop in the afternoon, and we have 2 faculty members from the Carey Business School that will help attendees focus on, change management at their agencies.
So it's a very practical working session for police chiefs, sheriffs who want to bring that kind of cultural change and that kind of take their agency to the next level.
Absolutely. And not just for chiefs, every person, from their frontline officer, like any of the command staff. And the goal is to let people know that changes can be made at every level. It's possible. And also just to get people in a room talking to one another, because the reality of it is, in order for us to make change, we all need to be at the table together.
It's super inspiring. It's almost like a physical manifestation of what the foundation is trying to accomplish. It's super exciting. I
Thank
put in my application. I hope I'll be accepted. I hope I'll fight my way through to get a spot. So in if in that context, if you could walk, what would make you walk away from that event and say it was successful? What does success look like to you for this symposium?
I would be happy if people are connecting, having conversations that continue after the symposium, remaining engaged and realizing that this isn't just a singular learning opportunity. This is about a process that we want you to take back to your agency and continue to be engaged. I really want to look at this as a start to a movement.
For sure. And I think to your point, that's how policing, that's how it works in the United States, is that because of the 18,000 agencies, it has to start with these relationships. It has to start with these connections, people who have a shared interest or a shared passion, and connecting them together across the country means it's kind of like, it's the kindling to kind of start the fire to allow these topics to kind of surface and to have life, well beyond the symposium itself. If people wanted to learn more about the foundation, wanted to donate, as Pepperball is, and I would encourage anyone listening to donate and write a check. How can they learn more about the foundation and about the symposium and about how they might get involved?
Absolutely. Thank you. You can go to the website, hclf.org, and that has information about the symposium, the full agenda, all of the speakers, as well as additional information about our programs. And we're also on social media, LinkedIn, X, and Facebook, and you can also connect with us as well. And I just want to highlight that we are interested in working with anyone who is interested in making changes. We cannot do this alone, and we want to be a unifying body to bring together folks so that people won't have to go through what I went through.
Yes, and to start not start, but to continue the work that's being done in thousands of agencies across the United States, to acknowledge the challenges, these mental challenges that these brave officers face, and the challenges that their families face, and to your point, start to bring a bit of preventative efforts to lessen those impacts, because no one should have to go through that, not the officers or their families. As we start to kind of head toward the end of the podcast, if maybe just a simple question: if there was one thing you would wish that every law enforcement officer or anyone listening today would hear, what would that be?
Asking for help is not a sign of weakness. It is a sign of strength and resilience.
Amen to that. It's taken me many, many years, decades to figure that out. And it's something that I try to teach my children. It's to your point, it's not an easy lesson, for young adults and it's not easy for those who are going into these professions where bravery is required. But to your point, bravery then, if it masks if it for whatever reason stifles the ability to ask for help, that's a bad outcome. So it's okay to be brave, but it's also, I think it's important to be brave enough to ask for help, maybe is the best way of saying that.
Yes.
Well, Serena, thank you so much for taking the time to talk about the foundation. I'm just privileged to be kind of able to talk to you about something so horrific. That's generally horrific, but that you've taken something so horrible that's happened in your life and you've turned it into something that's so good. That's so inspirational to me, frankly. So thank you for taking the time to talk. I do have my last question, which I ask everyone, and that is, we make a small donation in your name to a foundation of your choice. This one might be the easiest. Yes, I might be actually be able to predict, but where would we make our foundation, make our donation in your name?
Thank you, Bob. I will welcome the donation to be made to the Howard C. Liebengood Foundation. And I just want to, highlight that the reason why I welcome, any help is because I want to make our resources available to every and any agency free of charge. And so that's my goal. And so I welcome, your donation.
Thank you. Well, thank you again, Serena, for joining us. Folks, what I don't know. I'm a bit speechless, which for those who know me, that isn't typical. That someone, you talk about this notion of turning difficult issues or things in your life into and looking at them as gifts, and that's easy to read about and it's easy to think about. Serena and what she's done is it's humbling to take that level of impact and to turn it into something so impactful, not only at a kind of a local level, but at a national level, that this foundation will start to or be a part of the change that's so important and so welcomed by police agencies across the country, that this foundation will provide the resources and the help, this non-for-profit, I should say, to Serena's point, this for free of charge to agencies who are budget and cost constrained, that they have a resource that they can look to, and that this is fully supported by the FOP and by the IACP. Just tells you how important it is and how important this foundation is. So please do, like I have and like Pepperball has, donate to the foundation, hclf.org. And just remember that, every time you see a police officer, to thank them and remember what they're going through and to have the empathy for what they're dealing with, and to be, I guess, I'll walk away on this Friday to be grateful that people like Serena have stepped up to create such impactful way of supporting these brave police officers. So that's it for this episode. Thank you all for listening. I hope you really enjoyed this, or I hope you had a chance to listen to it and appreciate it. It's I'm just so grateful that we can be able to do this and bring these topics to light. And again, always thankful to Pepperball, who has employed me as their chief executive officer and has sponsored this podcast. And as I say always, Pepperball brings non-lethal tools that police officers use to keep themselves and their communities safe. So for now, stay safe out there, and we'll see you next time.